Hi, I'm Julie Harper. I am a dermatologist in Birmingham, Alabama, and I have spoken this week on several occasions at the American Academy of Dermatology.
Hi, I'm Jonette Keri. I'm an associate professor at the Philip Frost Department of Dermatology at the University of Miami, and I'm also at the Miami VA. So we're going to talk about acne together.
Absolutely. So if you were going to sum up from this meeting some take-homes, maybe even one take-home from the acne sessions, what would it be?
I think what I learned from you, Julie, and from the other people in the American Acne and Rosacea Society is don't withhold treatment. Give people treatment who need it. Give it to our pregnant patients. Give it to patients who may be of a different gender identity. And finally, make sure that we don't hold treatment for isotretinoin. Get that isotretinoin going sooner. That's what I learned from you all.
How'd you know I wanted you to say that? We did not pre-plan that, and yet I think that was the take-home message. And that's a little bit of a new story.
Yeah.
It's not that we're against any certain treatments, but patients need to get to the treatment they need,
Yes.
whether it's isotretinoin or even a hormonal treatment. Get there faster.
Yes.
Get there faster, and I would say get specifically to isotretinoin faster.
Yes.
You know, and maybe even in a more mild end of the spectrum of the disease. And part of that is because we don't want acne. We need our skin to be clear, but some of it is the psychosocial part of this. Is that something that you think is important?
I think it's very important. We did a session on the psychosocial impact of acne. We know that patients who have acne are depressed, they're anxious. I have a pimple today, I'm a little anxious about that. So we know that that occurs and we shouldn't be afraid to treat them. And for sure, we shouldn't be afraid to treat them with isotretinoin if they need it. We can work with psychiatrists, we can work with different dermatologists, but we shouldn't be afraid to treat these patients. They need to be treated.
I would echo that, and I would also, one of the articles that I presented here at the Academy this time was the relatively new meta-analysis that pools together the data that we have on depression and isotretinoin, and it was published in the JAD, but it's such good information. When you pull those studies together, it really doesn't support an increased risk of depression. In most of the studies that were included, there was a decreased risk of depression, or at least not a change at all. So that doesn't mean that in one individual, it may not be a problem. We still have to adequately counsel patients. But anybody who is not using isotretinoin because they're fearful of depression in everybody, we just don't have evidence to support that.
And I like a meta-analysis because it shows study after study and it shows the safety. And we have one in our journal, but there's also one, I think, across the pond.
That's exactly right.
And the British have also supported the same type of information.
You are
that
exactly
it's
right.
safe.
That's right.